Hello guys, welcome back to the channel. So right now I'm going to talk about the tracheostomy tube. So what are the parts of the tracheostomy tube? So there are the plug, outer cannula, cuff inflating line, cuff. Also there is the inner cannula. Also there is the obturator. So these are the parts of the tracheostomy tube. So what are the indications of the use of tracheostomy tube? So if there is a patient who needs the permanent ventilation, prolonged artificial ventilation, we use the tracheostomy tube. So if there is another one medical condition is a laryngeal spasm due to the tetanus disorder, so we can use a tracheostomy tube. Also, if there is any tumor or any injury or any obstruction of the airway tract, then we use the endotracheal tube. So what are the complications of the use of tracheostomy tube? So the tracheostomy tube can cause the, as usual, tracheomalacia, which is the collapse of the trachea due to weak cartilage tissue in the trachea. So during the cough or vomiting or cough, mainly cough, so it causes the collapse of the trachea. So this one is the more important complication. So and the general complications such as injury to the local airway tract or any obstruction of the laryngeal tissue, laryngeal airway can occur as a complication. Also, the aspiration pneumonia may occur due to that tracheostomy tube. There is the one more complication which is the collapse of the lung. The use of cuff. Why there is a cuff? So when the patient needs the prolonged artificial ventilations, then we use a positive pressure ventilation. So to avoid the leaking of the gases, we use the well cuffed tracheostomy tube. Also, it keeps the tracheostomy tube in place, and also avoids the aspiration. So how much duration we keep this tracheostomy tube? So the duration for it is the 15 to I think 30 15 to 30 days we keep this tracheostomy tube. So that's what about the tracheostomy tube. We will catch you in the next one with the new topics. Thanks for watching.